As I was diving into the sources you sent for today's deep dive, one fact really jumped out at me. A horse's teeth continuously erupt throughout their entire lives.
Hmm.
It's so different from our own, static teeth, and it makes you immediately think about the unique dental care they must need.
Absolutely.
Welcome to the deep dive, where today we're unpacking a crucial yet often overlooked aspect of equine health: retained deciduous teeth, or what most of us know simply as baby teeth in horses. We've taken your stack of sources to really get to the heart of this topic for you.
It truly is a foundational area of equine health. And you're right, these aren't just temporary structures. They're actually critical for a horse's long-term well-being.
Right. So our mission today is to explore why these baby teeth sometimes don't fall out as they should, the cascade of problems that can cause, how veterinarians diagnose these issues, and the incredibly advanced ways they're being treated today.
Yeah, and prevention, too.
Exactly. We'll also touch on what you, whether you're a horse owner, an equestrian enthusiast, or just someone fascinated by animal biology, can do to help prevent them. Get ready for some serious aha moments about equine dental health.
Understanding this piece of equine development is absolutely key to ensuring a horse's comfort and overall health. It really shows how specialized knowledge directly improves animal welfare.
Okay, let's unpack this marvel of equine dentition then. The sources you shared emphasize that horse teeth are incredibly unique. They're called hypsodont teeth. What makes them so special, especially compared to, say, our teeth?
Well, what's fascinating here is that unlike our teeth that develop to a fixed size, equine hypsodont teeth have these elongated reserve crowns. They're deeply embedded in the jawbone,
Okay.
and they continuously erupt into the oral cavity. We're talking about 2 to 3 millimeters per year.
Wow, constantly moving.
Constantly. This constant eruption is a remarkable adaptation. It precisely compensates for the significant wear they experience from grinding coarse, fibrous feed.
Ah.
It's just a stark contrast to the static dentition you see in many other animals, including us.
So their teeth are always moving and wearing down. That makes perfect sense for an animal that spends so much time grazing. But when we talk about baby teeth, it sounds like they're just temporary. Yet your sources highlight that they're far more than that, calling them natural space maintainers.
Hmm.
What crucial role do these deciduous teeth actually play?
They're absolutely critical guides. Think of them as setting the stage for the adult dentition, ensuring everything lines up correctly as the permanent teeth come in.
Ah, okay, like placeholder.
Exactly, like natural placeholders. Plus, they facilitate early mastication, that means proper chewing from a young age, and they contribute to normal facial development. Horses go through a truly dynamic period from approximately 1 to 6 years of age. It's known as the mixed dentition stage.
Mixed dentition, right.
Yeah, when they transition from 24 deciduous teeth, that's 12 incisors and 12 premolars, to eventually having anywhere from 36 to 44 permanent teeth.
That's a lot of dental traffic happening in a young horse's mouth. Is there a typical shedding schedule for these baby teeth that vets look for?
There is, yeah, a pretty predictable schedule, although there's always some individual variation. The deciduous incisors, often identified using the triadan system as O1s, O2s, and O3s.
Right, the numbering system.
Yes, they typically shed around 2.5 years, 3.5 years, and 4.5 years, respectively. Then you have the deciduous premolars, commonly called caps. Those are the O6s, O7s, and O8s. They usually shed around 2.5 years, 3 years, and 4 years of age.
Okay, so quite spread out.
And it's important to remember that molars, the O9s, 10s, and 11s, they're permanent teeth right from the start.
Ah, no baby molars then.
No deciduous precursors for those. They erupt around 1, 2, and 3.5 years of age. So while timing can vary a bit horse to horse, these defined eruption times really help veterinarians pinpoint the age of horses affected by dental issues.
So the system is incredibly complex and precise. But what happens when things go awry? How does a deciduous tooth normally get shed? And what exactly defines a retained deciduous tooth?
Okay, so normally the permanent tooth erupts directly beneath the deciduous one.
Yeah.
It exerts this sustained pressure on its roots.
Pressure from below.
Exactly. This pressure stimulates the roots to resorb, meaning they essentially dissolve away. At the same time, the crown of the deciduous tooth thins out into a fragile cap.
Right, the cap people talk about.
Yes. A small gap often forms that the soft tissue attachments break down, and that allows the cap to loosen and just fall away naturally. A retained deciduous tooth, or RDT, is simply one of these primary teeth that fails to exfoliate or shed within its normal physiological time frame.
And the research you shared states that the most prevalent cause of this failure is when the permanent tooth emerges off-center, or at an atypical angle. How does that skewing impact this delicate process?
Well, if the permanent tooth isn't applying that necessary even pressure for complete root resorption.
The pressure isn't right.
Right. The deciduous tooth's roots won't fully dissolve, and the cap won't be completely expelled. This can leave fragments behind, or even physically impede the underlying permanent tooth from erupting properly.
Makes sense.
And there can be other factors too, like broader developmental issues, maybe something present from birth or acquired later, or even trauma to the developing tooth bud.
That's really insightful. And I saw something in one of the articles you provided about diet potentially playing a role. That sounds a bit surprising.
Yeah, it's an interesting theoretical idea. It mostly comes from observations in human pediatric studies, actually.
Oh, okay.
Some research suggests that reduced chewing forces, from softer modern diets, might contribute to retained deciduous teeth in kids. While it's not directly confirmed for horses in the specific literature we looked at, it's theorized.
Just a theory for horses, then.
Right. It's theorized that the shift in modern equine diets, less abrasive forage, more concentrates compared to, say, natural wild grazing patterns, could potentially influence the natural tooth wear and shedding mechanisms. It's a point of ongoing consideration in the field, definitely.
Interesting. So if these baby teeth don't shed properly, what are the actual consequences for the horse? It sounds like it could be a silent sufferer situation.
Indeed, it can initiate a significant domino effect of problems. First, you often see malocclusion, which is just abnormal alignment of the permanent teeth.
Things don't line up right.
Exactly. This leads to uneven wear, painful, sharp enamel points, and compromised chewing efficiency. Then the retained cap itself creates an abnormal space where food and bacteria accumulate,
Uh-oh.
leading to inflammation of the gums, gingivitis, and potentially severe, painful periodontal disease.
And it impacts the permanent tooth itself, too. That seems like a major concern.
Absolutely. The developing permanent tooth's pulp, thus the living tissue inside the tooth, can be put at risk. Or it can suffer from infundibular caries, which is a specific type of tooth decay unique to horses.
Caries, like cavities.
Sort of, but specific to the structure of horse teeth, or pulpitis, and inflammation of the pulp. It can even lead to an apical infection, meaning an infection right at the tip of the tooth root.
Deep down.
Very deep. And if a cap is removed prematurely, the underdeveloped permanent tooth can be exposed and significantly damaged. RDTs can also act as a physical barrier, leading to the permanent tooth becoming impacted within the jawbone. Stuck, yes. Or even causing eruption cysts, sometimes called teething bumps in young horses.
So what does this all mean for an owner trying to spot these issues? What are the clinical signs that might make you think something is wrong?
Well, the signs are often pretty nonspecific, which is honestly part of the challenge. Behaviorally, you might see things like head shyness, head tossing or shaking, especially when eating or exercising, or maybe rubbing teeth on objects.
Resistance to the bit, maybe?
Yes, resistance to the bit or halter during bridling. Grumpiness, lethargy, unexplained behavioral problems under saddle can sometimes be linked to.
And eating issues.
Definitely. Quitting is a big one that's dropping partially chewed food, or they might eat slowly, seem to have difficulty, or clearly favor one side of their mouth.
And what about more general signs? What are those subtle cues an observant owner might pick up on?
Things like decreased appetite, maybe weight loss, or just poor body condition despite eating. Excessive salivation, halitosis, just bad breath, can all be indicators. Facial swelling, those teething bumps we mentioned, are common in young horses around 2 to 5 years old and can be associated with RDTs, though of they resolve naturally. But here's the crucial part, and this is a key insight from your sources. Horses are incredibly stoic.
Right? They hide pain well.
Extremely well. Many, even with advanced dental disease, will suffer in silence or sort of adapt to their discomfort. This means relying solely on obvious clinical signs will almost certainly lead to delayed detection, often until the pathology is severe and much more complex to treat.
So you can't wait for the big signs.
No, you really can't. This silent sufferer phenomenon profoundly reinforces the need for routine, proactive veterinary dental examinations. No news is definitely not good news when it comes to horse dental health.
That silent sufferer phenomenon is truly vital for owners to grasp. It means we can't just wait for obvious problems. So if the signs aren't always clear, how do veterinarians truly diagnose RDTs? What's the process?
Well, a meticulous, complete oral examination is always the foundational first step. And this isn't just a quick look.
Needs sedation, right.
It really requires standing sedation, yes,
Yeah.
for both patient and personnel safety. Plus a full mouth speculum to keep the mouth open stably, a powerful light source for clear visibility, and a dental mirror to see all those hard-to-reach areas.
Getting good look everywhere.
Exactly. The vet will visually inspect and manually palpate all the dental structures, incisors, canines, and especially those cheek teeth and the surrounding soft tissues. They'll use the triadin system, that universal standard, for identifying individual teeth.
So they're really getting in there and checking everything. But if the problem is often hidden beneath the gum line, like you said, that sounds like a regular exam might not be enough to get the full picture.
You're absolutely right. Clinical signs and even a thorough basic oral exam are often insufficient because they simply cannot visualize structures beneath the gum line. We're talking reserve crowns, roots, underlying bone,
Hidden trouble.
precisely. This is where advanced diagnostic imaging becomes indispensable. Radiography, or X-rays, is a critical tool to assess these hidden structures.
What do x-rays show?
They help differentiate RDTs from other issues, like supernumerary teeth, extra teeth, and they evaluate the precise orientation and root resorption of the deciduous tooth. On an X-ray, a retained deciduous tooth might show a more mature root structure and a shorter reserve crown compared to the permanent tooth below it.
Okay.
It can also show signs of periapical disease, that infection around the root tip. You might see radiolucency, darker areas indicating bone loss or blunting of the root tips, or loss of the lamina dura, that dense bone lining the tooth socket.
And what about CT scans? The material you provided calls that the gold standard. Can you give us the quick sort of explain it, like I'm a 5-foot version of what that means for a horse's jaw?
Okay. Computed tomography, or CT. Yes, it's emerged as the gold standard, especially in referral centers. For a horse's jaw, it basically means we get vastly superior anatomical detail and a full three-dimensional view.
3D view, that's key.
Absolutely. It's crucial for assessing the intricate apicoalveolar aspect. That's the area where the root tip meets the surrounding bone and the reserve crown of the teeth. CT can pick up subtle changes that radiographs might miss, and it's invaluable for precise surgical planning.
Planning the surgery better.
Exactly. And the advent of standing CT systems has also made this advanced diagnostic more accessible. It reduces cost and avoids the risks associated with general anesthesia.
So it's really not an optional add-on, but fundamental for accurate diagnosis and truly precise problem-driven treatment.
Precisely. Advanced imaging is fundamental for what we call pathology-driven intervention, meaning treatment based on the actual underlying problem, not just managing the symptoms. It lets veterinarians truly understand the hidden extent of the issue, things like incomplete root resorption or impaction, ensuring that treatment is targeted and effective.
Got it. Once a retained deciduous tooth is diagnosed, what are the strategic solutions? How are these issues managed and treated in a practical sense?
Well, the primary goal is always early detection and timely intervention. That's paramount for successful resolution and preventing things from getting worse. Most retained deciduous teeth are managed by simple manual extraction.
Pulling the cap.
Essentially, yes. Typically done understanding sedation with local anesthesia to ensure the horse's comfort and safety.
And I saw a strong warning in the sources. Do not remove these caps prematurely. Why is that so critical? What's the absolute biggest risk in doing that, even if it seems loose?
This is a truly critical point, yes. Removing a cap before it's physiologically ready can severely damage the underlying permanent tooth's dental follicle, or even the tooth itself, which is still developing and quite fragile at that stage.
Damage the adult tooth.
Exactly. This premature intervention drastically increases the long-term risk of problems like infundibular caries, pulpitis, apical infection, or even the complete loss of that permanent tooth down the line. So intervention should ideally occur only when the cap is already loose and the permanent tooth is visibly erupting beneath it. Patience is definitely a virtue here.
Good advice. What about more complex cases where manual removal isn't enough? One of the articles you shared really emphasized the shift towards minimally invasive techniques. How has the approach to these situations changed?
Yes, significantly. There's been a major evolution in equine dentistry towards minimally invasive techniques performed on the standing sedated horse. This has largely replaced older, traditional repulsion techniques.
Pushing it out from the outside.
Right, which involve pushing the tooth out from the outside of the jaw and frankly had high complication rates. Modern equine dentistry is now a highly sophisticated specialty. Techniques like partial coronectomy are used.
Coronectomy.
Yes, where part of the tooth crown is carefully removed. This facilitates easier, less traumatic standing intraoral extraction, especially useful for young horses with tightly interlocked cheek teeth. This technique shows really high success and low complication rates.
That sounds like a massive step forward in patient welfare. What other advanced techniques are being used now?
Tooth sectioning is another one. Here, the tooth is carefully divided into smaller, more manageable sections using a specialized water-cooled burr.
Cutting it up first.
Basically, yes. This is helpful for teeth with complex anatomy, like curved roots or existing fractures, and it minimizes collateral damage to surrounding structures. Then there's minimally invasive transbuccal extraction, or MITSE. Yeah, MITSE. This involves creating a tiny incision in the cheek to directly access and extract teeth that have fractured or absent crowns, ones you can't grasp conventionally from inside the mouth. A huge advantage is that MITSE often avoids the need for general anesthesia.
Standing sedation again.
Exactly. Which promotes faster recovery and less stress for the horse overall.
So it really sounds like these surgical advancements are directly enabled by the diagnostic progress we just talked about, the imaging. There's a true synergy at play.
Absolutely. Spot on. The ability to perform these complex, minimally invasive procedures is directly enabled and propelled by parallel progress in diagnostic imaging and refined standing sedation and pain management protocols.
They go hand in hand.
Completely. Better imaging leads to more precise surgical planning, and improved sedation makes these complex procedures feasible and safe for the horse without the higher risks of general anesthesia. It's a truly transformative approach to care. The big takeaway is this commitment to less invasive, more comfortable, and ultimately more effective care. It's a massive leap forward.
And what about post-extraction care for a horse? What does an owner need to know?
Right after sedation, food and water are usually withheld until the horse is fully recovered and can safely swallow again. A temporary adjustment period for eating is common while the extraction site heals.
Soft food, maybe?
Sometimes, yes, depending on the case. Systemic antibiotics might be considered, especially if there's a concern about bacterial infections developing in the socket. And diligent, regular follow-up exams are crucial to monitor healing and promptly identify any potential complications.
Makes sense. Given all of this, what are the potential long-term consequences if retained deciduous teeth are left untreated? And what's the overall prognosis for horses that do get treatment?
Well, if left unaddressed, the consequences of untreated RDTs can be severe and progressive. You can see permanent alteration of the dentition, chronic pain, impaired chewing efficiency leading eventually to weight loss, advanced periodontal disease, and those apical infections we talked about, infections at the root tips. It can profoundly impact a horse's well-being and performance.
And even with treatment, are there complications with extraction? For someone who might not know, could you give us the quick explain it? Like, I'm a FIFA version of what something like osteomyelitis means for a horse's jaw?
Okay. So while modern oral extraction is generally preferred due to lower complication rates compared to older methods, issues can still arise. It's mainly because equine teeth are just so large and firmly attached in the jaw.
Big roots.
Very big roots. Studies report complication rates up to maybe 13.6% for oral extractions, though thankfully most resolve pretty quickly. Common issues include infected sockets. Think of it like a dry socket in humans, very painful. Osteomyelitis. That's basically an infection of the bone itself surrounding the tooth socket.
Ouch, bone infection.
Yes, it can be serious. Other things like retained fragments or damage to adjacent structures can happen too. But it's important to note that the most severe complications are often linked to pre-existing advanced infections. So again, early intervention helps mitigate this risk significantly.
So it's a careful balance of risks and benefits then.
It is. The risk-benefit analysis almost always favors timely intervention. Delaying treatment just to avoid potential minor extraction risks can allow the primary problem, the RDT, to escalate into far more complex and debilitating conditions. A calculated surgical risk often prevents a greater, more certain, and ultimately more severe pathological outcome down the road.
That makes a lot of sense. So with proper and timely removal, what's the prognosis like for these horses?
Generally, the prognosis for horses with RDTs is excellent with timely and appropriate removal. Horses often recover surprisingly quickly, resuming normal eating habits almost immediately after the sedation wears off.
That's good news.
It is. And even in those unfortunate cases where a permanent tooth is lost due to complications, diligent ongoing dental maintenance by a vet can ensure a functional and pain-free mouth for the horse's lifetime.
That's a relief to hear. So what can horse owners do to prevent these issues in the first place? What are the best practices for dental care in young horses?
This really is the cornerstone, prevention. Regular, proactive dental examinations are crucial. A minimum of annual exams is recommended for all horses throughout their lives,
At least once a year.
at least. But for young horses, specifically between 2 and 5 years of age, that period of intense dental maturation and shedding more frequent assessments are definitely needed, ideally every 6 months.
Twice a year for the youngsters.
Yes. This increased frequency is vital for monitoring eruption, identifying those caps before they potentially become retained, and managing any sharp enamel points that can develop rapidly during this time. Early detection is always, always key for successful resolution.
So it's a proactive care, not just reactive, and making sure it's professional care.
Exactly. Leading organizations like the AAEP in North America and BIVA in the UK strongly advocate for routine professional dental care. This means care by licensed veterinarians or qualified equine dental technicians who follow best practices.
What do those practices involve?
They emphasize comprehensive oral exams using sedation, a full mouth speculum for proper visualization, and adequate light. And importantly, echoing what we said earlier, their guidelines strongly caution against the premature or aggressive removal of deciduous caps because of the risks to the underlying permanent tooth.
Right, reinforcing that point. And what about diet? Does that play a role in prevention or promoting healthy shedding?
Yes, diet is important too. Providing a diet rich in long fiber is vital. Chewing that long fiber encourages the necessary natural sideways grinding motion of the horse's jaw, what we call mandibular excursion.
Side-to-side chewing.
Exactly. And that promotes even wear of the chewing surfaces, which is crucial for these continuously erupting hypsodont teeth. Unless there's a specific medical reason, avoiding diets composed exclusively of soft or pelleted feeds is generally advised, as these might not provide sufficient abrasive action for natural wear and the normal shedding processes.
Got it. So as we've seen, those seemingly small baby teeth in a horse's mouth are part of an incredibly sophisticated system. Understanding how they work and what happens when they don't really unlock so much about a horse's overall health and well-being. And that silent sufferer concept really reminds us why proactive professional care isn't just recommended, it's absolutely essential.
And the shift we discussed in modern equine dentistry towards standing, minimally invasive procedures coupled with advanced imaging. It truly represents a more compassionate and effective approach to care. It's really a testament to how specialized knowledge and technology can directly transform animal welfare.
It really does. It makes you think about the immense forces a horse's mouth endures daily, grinding pounds and pounds of fibrous material. What does this deep dive into their temporary baby teeth reveal about the intricate balance of growth and wear in the natural world, and maybe our responsibility to help maintain that balance?